Good morning, everyone. We're gathered here on Treaty 6 territory, and I acknowledge the Métis people who share a deep connection to this land. I'm joined here today by our Alberta NDP women MLAs, and of course by our leader, Rachel Notley. I'm so pleased to be speaking with Albertans on International Women's Day, a day for us to reflect on how far we've come in our work towards gender equality and to recommit ourselves to the work ahead. And as the Alberta NDP critic for Status of Women, well, what used to be Status of Women, I'm so proud of the work that our movement has done to support women, advocate for women, and work with women. And I'm so proud to be running alongside extraordinary Alberta women with backgrounds in everything from healthcare, education, energy, technology, law, municipal government, seniors care, human rights, conservation, finance, ranching, farming, and so much more. And what's more, one of those women will be the Minister for Status of Women, a position that was, of course, abolished by Danielle Smith. Women deserve quality health care. They deserve health care that's there for them when and where they need it. And we, the Alberta NDP, will ensure that all Albertans have access to health care. Which brings us to why we're here today. And for an exciting announcement, it's my absolute pleasure to introduce our leader, Rachel Notley.
Well, thank you so much, Janis. It is so great to be here today with so many strong Alberta women. And thank you all for joining us on the International Women's Day for this important announcement. Now, as Janis mentioned, I'm committed to leading a government that works for all Albertans. And to do that, we must ensure that Alberta women don't just have a seat at the table, we need to have half the seats at the table. And part of the reason for that is part of the reason that's so important is so that we can ensure we have policy making, law making, and decision making that reflects the real life experience and priorities of women. By doing that, we're more likely to focus on making decisions that will improve the lives of women. And so that's why today I am very excited to announce just one of those decisions that would otherwise be overlooked, but I believe is very important. And that is this. Should the Alberta NDP form the next government, we will offer universal access to free prescription contraception across the province. Yeah. Universal coverage for prescription contraception will save Albertans money, and it will help women fully participate in our economy and every aspect of our society. Universal access to free prescription contraception in Alberta will ensure that women are more in control of their lives and more in control of their own economic future. This program would cover oral hormone pills, contraceptive injections, copper and hormonal intrauterine devices, subdermal implants, and Plan B. The savings for Albertans without prescription plans from their employer will be immediate, ranging anywhere from $240 per year for oral hormone pills to upwards of $500 per year for IUDs. For someone buying the pill every month, this program will save them up to $10,000 over their lifetime. Based on the costing of a similar program just announced in BC, the total cost of the coverage to the provincial budget would be roughly $30 million per year. Now, in addition to BC, we already see this type of coverage in other jurisdictions, including in Australia, New Zealand, the UK, and many Scandinavian countries. That's because it's good health policy, good economic policy, and it's the right thing to do. So, as we celebrate women, and I do mean all women, cisgender, transgender, two-spirit, know that the Alberta NDP sees you today and sees you every day. I will always stand up with women, and for the rights of women. And I'm so very proud to be making this commitment to empower Albertans right across our province. So thank you very much, and I'm happy to take any questions that you might have.
Thank you. Just a reminder, if you're on Zoom, it's the raise hand function. If you're on the phone, it's *9. We'll start with questions in the room.
Ms. Notley, I spoke with Janet last week. She expressed concern about the women's shelters, the funding shortfall, the shortfall of funding basically since 2014. What are your plans to address issues with women's shelters?
Well, I think there's several different plans. I know that there's been quite a debate over whether or not women's groups refused money from the provincial government in this budget. The Premier claimed inaccurately, dishonestly, that they had refused funding when in fact all they had done was say that the funding that was being offered was not enough. And we understand that the pressures on groups that provide services to women fleeing violence and who need that support have grown considerably since COVID, and we are very committed to meeting with those folks and offering them the level of support that they need, starting with the level of support that should be provided when it comes to income supplements for folks who work in that sector. We know the government has offered that for other people in different forms of nonprofit, but it hasn't been offered to people who work in that sector. And we're also committed to ensuring that that money is matched. So we'll have more detail as we get closer to the election, but generally speaking, people can expect much more ambitious funding from Alberta's NDP to protect women and other Albertans fleeing domestic violence and trying to adjust to and move on with their lives.
We'll go to the phone, and just a reminder to state your name and outlet and who you'd like to direct your question to, please. Lisa,
Hi,
your line is
Lisa
open.
Hi, Donna. I'm wondering if you can. I know you mentioned that this is universal access to free prescription birth control, but have you considered extending access to make some of these birth control contraceptives available over the counter?
Well, I think that's a different issue, Lisa, in terms of engaging with the medical professionals around the safety of ensuring that these drugs are available to folks. I think that's something we'd be certainly happy to discuss with physicians and experts to ensure that access is as great as possible. But one barrier to access is cost right now. And so this is about eliminating the cost barrier and providing a much more reliable form of health care to so many women, cis, transgendered, two-spirited, across Alberta.
Do you have a follow-up, Lisa?
Yeah, thanks. The way you describe it, it sounds like it's mirroring what the NDP has done in BC. Is there any significant difference between what you're proposing and what has been introduced in BC?
No, we are more or less modeling this on what was done in BC, understanding that there was a good deal of work that went into it in advance, and understanding that we can rely on some of that costing there, and seeing that, you know, it's the kind of thing that is long overdue in terms of providing equitable access to health care to, you know, at least half of Alberta's population.
Thank you. We'll just do one more pass for questions. A reminder, if you're on Zoom, it's the raise hand function. If you're on the phone, it's *9. Lisa, do you have another question? Sorry.
No, okay.
Okay, seeing no more questions, that concludes our press conference for today. Thank you very much.
Thank you. Watching, and to learn more, check out albertasfuture.ca.